Hopefully you got my email yesterday. I sent the lecture. I also put the video that we watched about Furtus, the fistulated steer. And when they're fistulated, it means they have that opening where you can access the rumen. I sent that video and I sent the Shih Tzu video. I couldn't find the cat video, which I really like, and I tried to search. But, you know, I sent those videos if you wanted to rewatch them or show your family members what you're getting into, feel free. But like I said, I wanted to just re-emphasize so the purpose of fistulation, to have a fistulated cow or a steer, a fistulated bovine, you could use a cow, you could use a steer. You would never use a bull because they are they're hard to handle. The point is, one, for teaching. So if you have them in a hospital, you can use them to teach about the rumen. And the second thing is you want to be able to access those contents and do what's called transfomate a sick cow. So it's kind of like someone said a probiotic yesterday, Activia. You take the good bacteria out of the healthy fistulated cow, you take some of that out and you give it to a sick cow. Because again, when they're hospitalized, their GI system is off. Sometimes their GI flora, meaning their bacteria, is off. And to get them feeling better is to, put this good bacteria. So that is really the purpose. Not every farm is going to have one of those, cows on their system. Okay. So we've talked about the two different stomachs. Okay. We've talked about the rumination. Now we're moving on to the small intestine. And the small intestine, it basically takes chyme. So once stuff leaves the stomach, it is now chyme. So it's going to take it from there all the way to the large intestine. And this is where the majority of absorption of nutrients occurs. So the small intestine is essential for proper digestion. There are 3 parts, and it goes duodenum, jejunum, and ileum. You need to know the duodenum is the very first part of the small intestine. I kind of call this spot on the picture. If you look here, this is digestion central. You've got the stomach, you have the liver, which we're going to talk about, the pancreas, and the duodenum. So this is where a lot of that and it's just the diaphragm would be right against the liver. So the stomach and the liver are up against the diaphragm in the abdomen. Now, a student, they said, how do we remember? Okay, did he pee? Okay. If you put him on the potty pad, he might pee. Okay. Okay. Sorry, I guess it's raining harder now and the puppy doesn't want to go outside now, so I might get some interruptions, sorry. So we have duodenum, jejunum, ileum, and the way one of the students came up with how to remember this, DJ ileum, like DJ ileum. When I'm in class, I usually go, like DJ. I know, I'm really weird if you guys haven't figured that out, but I actually had one of the students said that at their graduation speech about me. I was like, oh my gosh, you remember me saying DJ ileum? But I had a student come up with that because you need to know the order and you need to know the part. So DJI is the order, duodenum, jejunum, and ileum. Now, they are suspended from a mesentery. And the mesentery, remember, is the blood supply. If you pick up the intestine, it kind of looks like now that's not the omentum. The omentum is that netting that covers the intestines and the abdomen. The duodenum, or the mesentery, is the attachment, the blood supply to all the intestines. Now the duodenum receives the chyme from the pylorus. The jejunum is actually the longest part. And this is where we have a lot of chemical digestion and absorption. You do a lot of important secretions happen in the duodenum that facilitate digestion. And then you've got your chemical digestion. And then the ileum, which is the last component, is what empties into the large intestine. Now, this is an important slide. So this is slide 61. What you need to know, and this is the other species differences, is depending on the species, the ileum is going to empty into different spots, okay? If we're talking about a horse, the ileum empties into a very large cecum. In the horse, the cecum is very prominent. And the cecum is actually where horses, because they're hindgut fermenters, that is where they ferment their grain. Cows use the rumen, horses use the cecum, okay? Now, if it's a dog or a cat or a person, the ileum is going to open directly to the colon. It goes ileum colon. The cecum in dogs, cats, and people is like a little pouch, like kind of hanging off the intestine. It's not like a big pouch. We can look, we can find it on dissection. You can see where it ends, and you see this little pouch. In people, that is right near where the appendix is. When someone has an appendicitis, it usually causes inflammation and pain in our cecum, but the appendix attaches to the cecum, and it's kind of like a little blind. So you can take out the cecum in a person. It comes out with the, if they remove the appendix. So if someone has an appendicitis, usually that gets really inflamed and painful. Now in a cow, like a ruminant species or a pig, it goes to the cecum, then to the colon. But the cecum in a cow or a pig is not prominent for digestion. Stuff is going to kind of just move through the cecum. Okay, so let me go back. The cecum, it goes ileum, cecum, colon in a horse, but the cecum is prominent. In a dog, cat, and person, it goes ileum, colon. And then in a cow and a pig, it's ileum, cecum, colon, but the cecum is not prominent in the digestive process. So if anybody, people, you need to write that out or make a note to remember it from this slide, because it's an important piece to digestion and how they are arranged. Now, if you look at the small intestine, now this is microscopic. They have like these, if you're watching me, you see me kind of go up and down. They have like these folds. Think kind of like in the stomach. The stomach had those folds that were called rugae, and stuff can get in between the folds and it helps for absorption. Okay. In the small intestine, they have like loops and coils, but they have folds or plications inside the mucosa. So it's not completely flat. There's like little folds, and then there's villi. Now, if you look at this picture, this whole thing is a villi, one villi. Okay, it's kind of up like here. On the end of it, on the very surface, you have these microvilli, which are sometimes called the brush border of the intestines. We will open this in dissection, and you can see it kind of looks fuzzy. If you open up the intestines and kind of open it up, you can see that it's kind of a fuzzy appearance. But what happens is, and maybe I usually draw this on the board in school. Okay. Okay. I don't know if you can see this, but usually what happens here, excuse me, this is the inside of the intestine. Here's the chyme moving forward. This is a villi, this is a villi, this is a villi, and then the ends of these are covered with a brush, okay? When chyme moves through, chyme can go into these little pits, okay? These are called crypts. This is an intestinal crypt. That increases the amount of absorption of nutrients. So the chyme will go in here, Does that make sense to everybody? Now let me give you an indication. Okay, say you have a dog with diarrhea. We have a dog, the intestines are inflamed, they've had diarrhea, and it causes inflammation. Sometimes what happens is when we have intestinal inflammation, do you see how these villi swell together? So these are now swollen. So now you have the chyme, but how is it going to get in here to be absorbed? The only absorptive surface is right here. If these are all swollen together, then the chyme can't get in here and less is going to be absorbed. Now, the big consequence when an animal has chronic diarrhea is that what happens is stuff moves through too fast. And what that does is it decreases time that nutrients can be absorbed. I mean, if you have a dog that has a chronic diarrhea, chronic parasitism, if they have pancreatic insufficiency, those dogs or these cats that have IBD, cats with inflammatory bowel disease, what happens is they get very skinny and they usually have a poor hair coat. And a lot of times they're starving. And it's because everything's moving through so fast. They're not accessing their food. If we can decrease the inflammation, we can open up those crypts back. And then if we treat the underlying cause of the diarrhea, we slow down the chyme, then they're going to start to absorb from their meal. Okay. Now, inside each villi of the intestine, this is an extension of the mesenteric blood flow. You look here, inside each villi is capillaries. Okay, so you have an artery, a vein, and you have a lymphatic vessel. The lymphatic vessels are what absorb the fat from the diet. Okay, I'm going to talk about that. But here's the capillaries. And what the capillaries do inside the intestine, well, they bring oxygen and they pick up CO2, just like I've explained. The other thing is they are going to absorb the nutrients from the diet into that bloodstream. So it's very important that we have good absorption at the level of the small intestine. The lacteals are going to absorb the lipids. So the fat in the diet is going to be absorbed through the lacteals, and lymphatic fluid tends to have a higher fat content because it helps carry these fat soluble molecules into the blood. They will take that to a thoracic duct and into the vena cava, and then that fat can be distributed throughout the body and used. Now, one key here, boom, right here, the capillaries are going to absorb nutrients and they are going to transport them to the liver. I'm going to say this loud and clear. All intestinal blood flow, all of the blood that is going, you know, remember I said blood always goes back to the heart? If it's coming from the intestine, it's going to go to the liver first. The liver is going to process, and then that blood is cleared to go back. And that's going to be very important to understand. I kind of call the liver, think of it like the body's Brita filter. A Brita filter. When you pour in water from the tap, the filter takes out what's bad, leaves what is good, and then you have your water. So the thing is, the body is like when an animal eats food, the body's like, maybe there's things in here we don't want. Maybe there's things in here that we don't need from the diet. Or what if the dog ingested a toxin? So what happens is all of the blood, before just going to the rest of the body, the liver is going to process and it's going to remove wastes or toxins, and then the good nutrients are going to be free to stay in the blood and go where they need to go, or the liver is going to store some of them. So I want everybody to understand that all blood flow from the intestine goes through the liver for processing first. It's exactly why the liver is put where it is, right near all of that digestion. we're going to say more about that, but that's important to know. All intestinal blood flow goes to the liver before it goes to the rest of the body. Now, I already talked, let me go to this picture for a second. Okay, I'm going to be talking about here about the duodenum for a second. Remember, I said let's think about the stomach and food or chyme moving to the intestine as like an assembly line. And I said sometimes things need to be slowed down. So you have the duodenal mucosa, basically the lining of the duodenum, can secrete cholecystokinin and secretin. Now, what cholecystokinin does is it inhibits gastric emptying. It will also increase secretion of bicarbonate. Bicarbonate is a buffer, and pancreatic digestive enzymes. So when this is secreted, the stomach is going to slow down, and we're going to increase buffering and digestive enzymes. So why does this happen? It doesn't happen every time. If the animal has eaten something very high in amino acids, which is high in protein, or if they have very fatty foods. So if the duodenum detects, hey, this is really fatty, this is high in protein, or if it's a low pH, if it's very acidic, they want to buffer it. So hopefully this makes sense. Remember I said if I'm the duodenum and you're the stomach and you just keep sending me stuff and I'm trying to process it and I'm like, whoa, this is really fatty, high protein, it's really acidic, it's going to hurt. And I'm going to secrete these things, and then the stomach goes, okay, I'll slow down. And then the bicarb is going to decrease the acidic content, and it's going to help break down the fat. Now, secretin, what secretin does, it's going to decrease hydrochloric acid production in the stomach and increase biliary bicarbonate. So basically, secretin is saying, stomach, you are way too acidic. You are making things, because the duodenum doesn't want, it has to be at a certain level of acidity. There's not a certain value. But all I'm saying is that if the stomach is over secreting hydrochloric acid, we don't want that to damage the duodenum. So secretin will give feedback. So this is all kind of giving feedback to the stomach, but it's from what is entering the duodenum. If somebody doesn't understand that, please type something. Is Ireland still alive? I'm just checking. I haven't heard an update that she's not passed out. But I want everybody to understand the relationship between, okay, good deal, Ireland. Had a little potty accident with the puppy, so okay. Pause. So yeah, so this is the relationship. It's just a relationship to understand, because when I talk about the gastric emptying, remember I said the duodenum can slow down the stomach, and it's doing that because it needs extra time to process the chyme that it was sent. If it's too acidic, too high in fat, too high in protein. This is why sometimes when we have animals that have intestinal disturbances, they've got diarrhea or whatnot, what is the main thing that we tell them to do? Bland diet, boiled hamburger, white rice, things that are very easily digestible, because we know we're trying to take it easy on the intestinal tract. And we know that digestive functions are off. So let's give it something easy to digest. We're not like, give them a high fat meal or give them a ton of protein. So those are things that we do. So if there's any questions, yes. So I will tell you, when animals have come into the clinic, most clinics carry a prepared intestinal diet. I mean, I'm very old school. I'm older. Prescription, Hill's prescription diet. Our clinic had all the different kinds, and it was called ID, which stands for intestinal diet. I kind of like that about Hill's prescription diets, because DD is for skin, JD is for joints, HD is for heart, UD is for urinary. A lot of them, the name of the food kind of pertains to why we're using it, but it is low in fat, very digestible. But Sean, I had clients that they're like, can we home make a diet? You can use boiled chicken, boiled hamburger, and we usually cut it 50-50 with boiled rice. And a little FYI, I always like to throw this in. Everybody, these health crazes, everybody wants to get into brown rice or wild rice. That is not good for dogs with intestinal problems, because the hulls are very high in fiber or are not as easily digestible. So I always tell clients, because they're going to be like, oh, brown rice must be better than white rice. Not in this case. When it comes to digestion, the high starch in the white rice actually helps the digestive process. Sometimes we tell clients to give their dogs pasta and overboil it, like really boil it, not al dente. But the starch in the pasta and the starch in the rice actually helps. So I always tell clients, I go, just get some cheap minute rice. When my dog's stomach is upset, I usually just boil a batch of it. Sometimes I just give him rice and I add it to his food when his stool's a little soft. I just throw a handful on his dog food. But boiled hamburger, nothing sauteed, nothing fried, no skin. I had a lady that just went to the store and got her dog a rotisserie chicken and cut up the skin, and she's like, he's still not better. And I was like, because I didn't say go get a rotisserie chicken that's got seasoning and fat. I'm like, it looks boring as hell. I realize that. That's what your dog needs, boring and boiled. No seasoning. Yeah, I know. I'm like, clients, that's why I say this stuff. Don't do brown rice because you think it's better, and don't do the rotisserie chicken because it looks good. Boring, boiled. My dog eats it up like crazy. No seasoning whatsoever. And he thinks it's the greatest thing. So let's get into an important organ. And hopefully, did you guys talk about the pancreas in nutrition class? Hopefully you did. A little bit. Hopefully you did some pancreatic function. The pancreas is actually an endocrine organ. Okay, so when we do endocrine system, I'll get into the pancreas. But it has the endocrine, remember, the pancreas has endocrine and exocrine function. It has both. If it's exocrine portion, it has a duct. Any exocrine organ, something needs to exit it. Usually exocrine organs secrete something. Sweat, mammary, pancreas, those are all exocrine organs. So the pancreas has a duct that will take digestive enzymes to the small intestine. Now, it is a strange organ. It is flat. It looks, to me, it looks like flat scrambled eggs. I know that's kind of strange to say. You will all have to find this during dissection. I make everybody find the pancreas and show it to me. You're going to find it by first finding the stomach. If you find the stomach, which is close to the diaphragm behind the liver, and then you flip over the intestines underneath, you're going to find this. It looks kind of like a strip, like a curved strip, and it follows the curvature of the stomach. And then right here, it's going to, this is the duodenum. Now, do you remember I talked about the mesentery? This mesentery looks like a clear kind of like netting. You'll see some blood supply. The pancreas is embedded in that mesentery. So you almost have to kind of like pull this over. This little green thing here, That is the bile duct. So right now the other organs are removed, but that little green thing, so the bile duct comes in here to the duodenum. Underneath here, there is a duct that takes digestive enzymes to the duodenum. Now, the endocrine portion of our pancreas has different cells, but the ones you need to know, beta cells secrete insulin and alpha cells produce glucagon. Now, both insulin and glucagon is what keeps our glucose in balance. Insulin, after you eat a meal, insulin facilitates your cell's ability to use glucose or the sugar. So insulin literally goes, here's some sugar, here's some sugar, here's some sugar to your cells. When you have sugar in your blood, it is not in your cells. It is in your blood. Insulin is what takes it from the blood and gives it to the cells. So when we have dogs that are diabetic, if you have a dog with diabetes, that means he has too high of a blood sugar. And insulin, they usually have, they're probably insulin deficient and they need insulin injections, because what's happening is the animal eats, blood sugar goes up, but they have no insulin to give it to the cells. Now, on the flip side, if an animal is not eating, their cells still need sugar. Glucagon is a stored sugar. It's going to facilitate the animal can access stored glucose to elevate blood sugar. So if blood sugar is going down, glucagon is going to help raise blood sugar. So you see, insulin and glucagon keep our blood sugar in balance, one way or the other. Now, very important part is the exocrine portion of the pancreas. You don't need to know groups of acini. I just want you to know the exocrine portions. It all merges into a duct, and the duct will take digestive enzymes to the small intestine, the duodenum specifically. They will secrete bicarbonate and digestive proenzymes. Proenzymes are going to activate enzymes. Now, the exocrine pancreas will get stimulated and will start secreting if the animal even thinks there's food coming. When we do pancreatic testing in animals, specifically if we think there's exocrine insufficiency, that animal cannot eat. That animal can also not be anywhere by our kitchen. In our ICU at VCA, and actually our other ICU when I worked at Northwood, we had a dog in for testing. The dog had been fasted, and my boss was nearby. He was a criticalist, super great guy, great doctor. We're getting ready to draw the blood, and the kennel girl is feeding the kennel animals, and she's walking by with food. And my dog that we're getting ready to draw blood on, not my personal dog, is watching, and he's drooling and drooling. He's already activated those enzymes. My boss is like, well, let's send this dog home and we'll do this testing maybe tomorrow or the next day. And I was like, he hasn't eaten. And he goes, he's already smelling food. So he's already activating these enzymes that we're trying to test. Because normally we draw blood fasted. We would give the animal a meal, and in about an hour or two, sometimes we'll redraw the blood after a meal. So we're kind of trying to say, what are the enzymes with no food? What are the enzymes after a meal? Hopefully that makes sense to everybody. The feedback for the exocrine pancreas is neural from the nervous system, and it gets feedback from the endocrine system. Now, the enzymes that are more vital to digestion, these two you definitely need to know, lipase and amylase. You need to know these come from the pancreas. I'm telling you, if you have an animal, and animals get pancreatitis cases can be awful. Animals can die from pancreatitis. People can die from pancreatitis. If the pancreas is inflamed, a lot of times these values in the blood are going to be elevated. So one of the key markers for pancreatitis is we test lipase and amylase. Okay? Now, that is in the blood. So these enzymes we measure in the blood. There is also proenzymes, which are proteolytic. I've already told you what proteolytic means, breaking down protein. Now, when these enzymes are secreted from the pancreas to the intestine, they are inactive. CCK is what activates those enzymes. So chyme hits the intestines, proteolytic enzymes are secreted, CCK is going to detect, remember I said protein, high protein? It's going to detect protein, it's going to detect fat, it gets secreted and it turns these into trypsin, chymotrypsin. Now, if you see gen at the end of a word, that is an inactive enzyme. Think about it's going to generate an active enzyme. So trypsinogen is the inactive form of trypsin. Chymotrypsinogen is the inactive form of chymotrypsin. Okay? And whenever you see ACE at the end of a word, ACE, prolatase, do you see this? Those are an enzyme. Now, I only want you to know the first two. Okay, those are the most common. Hopefully everybody's still there, and let me explain what happens with the exocrine pancreas. There's something called, I'm going to type it here, it's called EPI, and you need to know what EPI means. EPI is exocrine pancreatic insufficiency. I just typed it in the chat. What happens, I'll never forget this case, and this was pre-Purdue, so this is when I was in practice before I went to tech school. We had a spastic German Shepherd. German Shepherds, it can be genetic in German Shepherds. So German Shepherds can get EPI. So this dog, it was a super wiry, skinny German Shepherd. And the owner says he has this awful diarrhea and he's starving all the time, but he's really skinny. So he comes into the clinic and my boss is like, okay, draw blood. And we actually tested the feces too. There's a trypsin test you can do on feces. It's gross, but there's another test you can do. But anyway, he goes, now go feed the dog. I go to give the dog the food. He literally dives into the bowl and probably eats the food not even in 2 minutes. He is sucking down this food. And I'm like, my God, like he practically knocked the bowl out of my hand. And then my boss is like, you got to take him out and get some feces. And probably about 10 minutes after eating, the dog has the most awful, smelly, I mean, parvo is the worst thing I've smelled as far as diarrhea, but this is a close second. And it was very fatty. Like it was very like oily. It was just, I'm sorry, I'm not trying to ruin your morning and maybe you want to eat breakfast, but basically what was happening is the dog would eat a meal and then he does not have the adequate digestive enzymes from his pancreas. So what was happening is the food was basically hitting the intestines and going right through. Sorry, Alicia. Yeah. It's awful. I have not seen a lot of these cases, but it does happen. But the reason why the dog is skinny and he's starving is he's eating, but the body is not absorbing the nutrients because it's going right through the small intestine. There's no digestive enzymes or not enough being released. And then why it's coming out fatty, the intestines can't break down the fat. So basically he's pooping out like, the owner's like, this dog eats, he has to go right outside. Like it's eat outside. If you've ever heard of, there's a drug called Prozyme. That is the trade name. So there's a drug called Prozyme. It is actually ground up bovine pancreas. So they take the pancreas from slaughtered cattle. They harvest the pancreas. They basically dry it out, process it, and the pancreatic enzymes that are in that pancreas, it comes as a bottle and it is a powder. So what you do is you take the dog's food and we had to put this dog on ID, which was low fat, low protein. And the owner would wet the food and sprinkle the powder on, and she had to let it sit for usually like 30 minutes. Why would we let the food sit with those enzymes on it? The dog could not eat for half an hour. It's basically, so, well, in fermenting, it gives the enzymes times to activate, but the enzymes were breaking down the food. So so the enzymes that we sprinkle on, that were the cow enzymes, basically pre-digest the food. So we give the enzymes a half an hour to activate and to break down the food. So when the dog would eat, it was already processed into things that he could absorb. Pretty soon the dog started having solid stool, and it didn't smell. I mean, it still smelled like poop, but not like the awful. And he started gaining weight. And it was really cool to see. He came back and I'm like, you look like a normal German Shepherd. So now this dog would have to be on that for life. So the owner would have to buy this. It has to be refrigerated because it's an active product, it's active enzymes. But all she had to do was make sure she let it sit for half an hour, and this dog did fine. So exocrine pancreatic insufficiency is going to lead to, this, what we call it's a malabsorptive disorder. Mal meaning bad absorption. So when you have a malabsorptive disorder, you're not absorbing what you need to sustain life and growth and normal function. Okay, let me start. I know we're kidding. Let me mention something about the liver. I do want you to know this is one of the associated organs because it's not within the GI tract. The pancreas isn't within the GI tract. It's like right next to it, and it's connected with a duct. The liver is right next to the GI tract. It's going to be connected via the bloodstream. It's also be connected with the bile duct. So it's, it is the largest digestive gland in the body. So the liver is considered a gland, and it is considered, most people will say it is a digestive organ, but it does a lot of special functions. So this is an important slide because I like to say, what are 2 functions of this or on tests, but like, what does the liver do? First of all, it's going to secrete substances essential for digestion. The liver produces bile. The gallbladder is going to secrete bile. So if you've ever heard of bile, or you know what a bile duct is or a gallbladder, a lot of people have gallbladder issues. Okay. The gallbladder, I'm going to tell you this right now, the gallbladder does not produce bile. The gallbladder stores and secretes bile. The liver produces bile. The liver does not secrete bile. The gallbladder does. Like your bladder. Your urinary bladder doesn't make urine. It stores urine. It releases urine. Your kidneys make the urine. So do you see what I'm saying? If you hear bladder, gallbladder, urinary bladder, those usually store something and release it. But the liver, bile is essential for digestion. Now, the liver can also synthesize or create nutrients, and it can release nutrients when needed. So it's going to, when the body needs, we talked about the body needs glucose. It excretes toxic substances that have either come from in the body or came from the digestive tract. When it says outside the body, okay, it's not absorbing through the skin from the outside of the body. What that means is the animal potentially ate something toxic. And remember I said, if they eat something, the body's like, that's a protective mechanism. They're like, if you ate something bad on accident, that blood is going to go to the liver. The liver's going to go, nope, we don't want that. That's bad. And it's going to get rid of that toxin. And then good blood is going to come. Now, this is important. Produces protein, produces cholesterol, blood coagulation factors. If we have an animal that has a clotting disorder or their blood is, I don't know if you've gone over platelets yet in Clin Lab 1, if you've talked about clotting yet, you may not have gotten to that. Does anybody want to comment on if they've talked about clotting factors or coagulation factors? Okay, they come from the liver. Now, obviously, when you test the blood, if clotting factors or coagulation factors are low, we're going to look at the liver. Sometimes dogs with hepatitis, which is liver inflammation. Sometimes dogs with liver cancer. Sometimes dogs with poisoning. Anything or a genetic clotting disorder has to do with the factors in the liver. If we're going to operate on the liver of an animal, and we saw dogs with liver cancer in oncology, we would send them. The liver has lobes like the lungs. A dog, you can take out a liver lobe. So if a dog has a tumor on a part of the liver, it can be removed through surgery, but there is no surgeon that I know that's going to cut into the liver without doing coagulation testing, because the liver is extremely bloody, and if they can't clot, that would be bad for the animal. So we always do clotting factor checks when we are working with the liver. And then the protein. If an animal has low protein, it's potentially an issue with the liver that we have to investigate. I want to stop there because this section's important, and I don't want to run into Nemer and get anybody in trouble. Does anyone have any questions about what we've talked about today? These are some important stuff coming up that we talked about today and tomorrow, like the pancreas, the liver, the digestive enzymes, the feedback. So definitely, you know, since you guys are at home, and one thing I tell my students when they study, like for a test, I've talked about a lot of stuff. I mean, does anybody remember anything I said about the teeth? Because that seems like, you know, I'm building. What you need to do in anatomy, other classes as well, is what I would do is just definitely focus on my notes from today, make myself maybe some note cards, maybe some flashcards, maybe answer the questions from the study guide regarding this. But try to look at your notes every day, because if you wait, you know, until the day before the test, and then you're going back and looking at this, it may seem foreign to you. Okay. So something to think about. All right. If you don't have questions, I will get this recorded and get it sent out to you.